The Cameroon Baptist Convention, Health Services and Humanity at Heart International, in collaboration with the Cameroon Association of English-speaking journalists Bamenda chapter, have joined forces in the fight against cervical cancer. During a capacity workshop in Bamenda on Friday, January 12, 2024, the over 20 journalists were drilled on the causes and the different ways of preventing cervical cancer.
Cervical cancer is a preventable disease. That is the reason why in 2020, the World Health Organization launched a strategy, which they call 90-70-90, to eliminate cervical cancer worldwide.
According to statistics, cervical cancer is the fourth common cancer and fourth leading cancer of death amongst women in the world, while in Cameroon it is the second leading cause of death amongst women.
Most especially in Cameroon, we consider that CSO, civil society organizations, plus the journalists, take this message to the communities that are not easily accessible by a lay person in Cameroon. So when we convey these messages through the media, a father in one village might be listening to the radio and might pass across what you journalists are conveying, and that is how this message is passed to that lay woman in the community that might not have had that opportunity to access a health facility to hear about cervical cancer.
With cervical cancer, the cause is easily known, making it easier to be treated when it is diagnosed early.
The main two things that we need to do as action is to vaccinate our children, both boys and girls, 9 to 14 years, and women from age 25 and above should do their screening regularly.
After the training, the journalists are expected to use their different platforms to educate the masses.
This training actually opened up my mind more to understand that the different HPV types in various localities could be different and they could act differently. It means that as journalists, we have a lot of research to do, we have a lot of studies to do, to go back and make sure that we understand the exact situation in Cameroon by working with experts like them to make sure that we are on the same footing, we are passing across the same message, and that we are doing advocacy that is specific to our context in Cameroon.
I'm a perfect example of one of those people who used to think that screening for cervical cancer has to do with a lot of process, maybe painful processes. But I've learned here that women can actually go for screening for this form of cancer without any stress. And also I now know that there is a vaccine, and my role here is to take this message to the community, touch everyone who has been afraid to go for screening and those who don't even know about the vaccine, that there is a vaccine, and equally they could be handled in the hospital no matter the level at which the cervical cancer has reached.
Every year, the month of January is observed as a sensitization month of cervical cancer, and every woman is encouraged to go for their screening.